Now at noon, a brand new way to support and transport patients with highly infectious diseases is in Atlanta today as part of a nationwide simulation. Medical staff from Emory Hospital and Children's Healthcare of Atlanta trained in the unit to prepare for the worst. Atlanta News First, Sarah Hammond takes us inside.
A game-changing medical device is parked in Atlanta today for training.
I sort of think about it as an ambulance on steroids.
The first portable biocontainment unit has been in the works for years and can be attached to a tractor trailer or a plane to transport someone with an infectious disease like Ebola to one of the 13 treatment centers in the country, something that hasn't been possible before now.
But there are large swaths of the country that don't have close access to some of these units.
All right, take a look. This self-contained unit is what hospital staff are training with this morning. It's the first of its kind and can house 10 patients in here at a time with highly infectious diseases, so they can be contained and cared for all in one. Dr. Andy Shane with Children's Healthcare of Atlanta says since both children and adults can be treated in here, families can stay together.
Which is not possible with the current ways that we have transport at the moment. They would have to be separated.
And Dr. Gavin Harris with Emory Hospital says this portable unit is for people with a highly infectious and contagious disease with a high mortality rate and limited countermeasures like vaccines.
If one of these agents were to unfortunately infect an American citizen, the ramifications could be enormous, and they could really strain the healthcare system, as we saw in the beginning days of COVID-19.
So that's why he says their training today is so vital.
We want to be prepared for any situation or event that may unfortunately arise. The only reason why we were so successful at treating patients with Ebola in 2014 in the United States is because the team's trained.
Harris says this piece of technology is a major expansion of the current care capabilities for these patients.
The approach would be to isolate them, but now the approach is really to not only isolate but also to treat these patients because they are human beings.
In Atlanta, Sarah Hammond for Atlanta News First.